Hi, my name is Melanie, and for this video, I'll be choosing the act utilitarianism, a specific approach between the borders utilitarian ethical theory. Act utilitarianism is focused on assessing the consequence of individual across to determine whether they maximize overall happiness or well-being. The core principle behind act utilitarianism is that we should always choose the action that produces the greatest amount of happiness or the least amount of suffering for the greatest amount of people. The greatest amount of people. Now let's break this down how act utilitarianism works. The first step is to identify all possible actions that could be taken in a given situation. Next, we examine the potential consequence of each action, focusing on how they will affect the well-being of those involved. Then we calculate the total happiness or suffering of each action would produce. This might involve factors such as how many people are affected and what extent they will. Finally, we choose the action that leads to the greatest net benefit, the one that maximizes happiness and minimizes suffering for the greatest number of people. In this framework, the good of an action is purely based on its outcomes. If the action leads to more happiness overall, it is considered morally right, even if it's harmful to a few in the process, as shown in this example. Now let's apply the act of utilitarianism to a moral dilemma in vaccine distribution. During the severe pandemic, a country has received 1 million doses of life-saving vaccines. However, the population at risk is 10 million people. The government must decide who gets vaccinated first. Healthcare is an essential personnel. They are the highest risk and are needing to keep hospitals and essential services running. The pros: they keep hospital runnings and ensure treatment for future patients, and prevent system collapse. The cons: only a small number of lives are directly protected. Next, it's elderly and immunocompromised individuals. They have the highest risk of severe illness and death. The pros are: reduces most deaths immediately. Cons: may not stop the spread as effectively as many are not active in public spaces. Then, general population. It includes people who are less vulnerable but still at risk of infection. The pros are: gives everyone an equal chance. The cons: fails to protect the most vulnerable and ensures social stability. The act utilitarianism states that we should take action that results in greatest overall happiness or benefit, instead of following a fixed rule. Each situation must be evaluated case by case to determine which choice maximizes well-being. In conclusion, by understanding the act utilitarianism detailed framework, it becomes clear that ethical decision making in the dystopian world is about focusing on outcomes and maximizing happiness. The structured nature of act utilitarianism can provide a clear guidance, but it also presents challenges in extreme situations. According to the Act Utilitarianism, the most ethical decision is to prioritize healthcare workers and essential personnel first, followed by the elderly and immunocompromised, then the general public. This approach maximizes survival, maintaining social stability, and reduces overall suffering. However, there's a other well-known example for utilitarianism is the trolley problem. The trolley problem is a classic ethical dilemma that helps explain the practical application of utilitarian principles. It presents a situation where you have to choose between two difficult outcomes, weighing the greatest good for the greatest number. Just imagine you're standing next to a lever that controls a trolley on a track. Ahead, the trolley is speeding towards five people who are tied to the track and cannot move. You have an option to pull the lever, diverting the trolley onto another track where it hits one person instead. Should you pull the lever to save five lives even though it means intentionally causing death to one person? Utilitarianism suggests that the best action is one that results in the greatest overall happiness, or the least suffering. In this case, pulling the lever might seem as the right choice because sacrificing one person to save five creates a better outcome for the majority, as shown in this picture, which we can use. This complex This concept the complex of a lever in the utilitarianism to a real-world dilemma of making decisions for the greater good, even when the choice is ethically complex. And that'll be it.